Hello, Father. Shall we begin?
Just a few minutes. Let Dr. Elizabeth and Lida ma'am, let them join.
Okay, Father.
Father Anthony, Father Rajiv
Yes,
is
sir.
here.
Yes, welcome
Gujarat.
from.
Gujarat.
Wow, very good. We are happy to have Gujaratis with us.
And I know William also. We were
Oh,
Gujarati
great.
companion. We are studying Gujarati together, Christian
Wow,
brothers.
wonderful. Excellent. That's great.
It was very kind of you that you keep giving me invitation.
Uh-huh.
And then I know your friends also, Aswati. We
Okay.
met in
Great.
Delhi.
Wonderful.
Yes. I think Sister Manjul also I know.
Oh.
We met in Delhi.
Oh, during last year, during the meeting.
So William is on the line?
Yes, he's there.
Yes, Father Rajiv, I am.
Yes, William, after long time, many years.
Yeah, I can see you now. 1 minute, you can see me now.
Sure. How are you?
I'm doing well, thank you.
Where are you now at present?
At the moment, based in Meghalaya.
My God.
For the past 4 years now, I'm in the village ministry, rice-based approach of community engagement.
Yes. Ours is a center for Navsurjan's Zeves Center for Human Development and then Human Rights Counseling and Legal Aid Center.
At Surat.
Surat.
Yes.
One is education. I take the social research and all kinds of things here. Also, legal counseling, legal aid. We also fight various cases.
Elizabeth ma'am, welcome. Dr. Elizabeth Shaini, thank you for joining. Our second resource person also is here. Our the person who is supposed to inaugurate, Dr. Lida Jacob. Once she is there, we can start.
Okay.
Ashwati.
Okay, shall we begin, Father?
Dr. Lida Jacob. 1 second. Let her also join. We have only 3 important VIPs. All 2 have joined. The third one, Dr. Lida Jacob IAS. Could you call Ashwati? Just try.
Okay, Father. Father, she will join in 5 minutes. Hello, Father.
India into a socialist, secular.
Friends, Lida ma'am will join within 5 minutes. We will just listen to the introduction, general introduction by Ashwati.
Okay, I would like to introduce about the organizing team of this webinar. And I would like to introduce about ADI, CAPS, Kerala Association of Professional Social Workers, and also LOCMUNCH. And these are the three organizing institutions of this webinar. First of all, let me introduce about what is ADI and its activities. ADI is an eventual shape of the 16-year-old Jesuit action with the people of Attapadi. Suitable schedules are planned and carried out by the people themselves. It aims at inherent progress of the tribals in Attapadi. Besides encouraging education, employability, and soft skill training, it is decided to organize a center for eco-education through the blooming of an eco-reserve for the future generation. And ERA set up in 24 acres of land at Mattattukadu next to Silent Valley National Park, basically emphasis on the evaluation of socio-economic progress made in Attapadi and thereby scrutinize the refinement made in the livelihood of the local group, specifically the tribal communities. Afforestation, biomass development, conservation of water resources, and promotion of sustainable income-generating activities are attempted through community-based organizations. And we have some objectives, and the objectives include to promote and preserve culture, language, art forms, and indigenous knowledge of Adivasis, to promote eco-friendly initiatives and biodiverse projects, to network, lobby on, and collaborate with eco-justice issues and movements, to empower the tribal youth to be self-reliant, employable, and competent, to accompany the students in their educational aspirations and integral development, to facilitate documentation and research on tribal and ecological issues, to encourage alternative healthcare systems and to preserve indigenous health practices and ethno-medicine. That's all about ADI. And now I will talk about what is LOCMUNCH. It's a program, and LOCMUNCH is or People's Forum is envisioned as a movement of and by the Dalits, Adivasis, women, minorities, urban poor, and other marginalized communities. About 100 organizations from 12 states have formed LOCMUNCH together with like-minded partners to strengthen the dignity and expand the rights of the priority communities by capacitating them to become informed citizens using access to entitlements as a tool. Now, I will talk about what is CAPS, the Kerala Association of Professional Social Workers. Kerala Association of Professional Social Workers is the registered professional organization for the social workers in Kerala. It is registered as a society under the Travancore Cochin Literary, Scientific and Charitable Societies Registration Act. The formation of CAPS has fulfilled the dream of many veteran social workers to unite their voices to deal with issues of professional interests. The association is formed with the purpose of promoting the quality and effectiveness of social work practices in Kerala. This association will be the common platform for all professionally trained social workers in Kerala. CAPS also intend to take up continuing education programs for practicing the professionals. CAPS is promoted by the Association of Schools of Social Work in Kerala, a registered body of the schools of social of all the schools and departments of social work in Kerala, and has the support of professional social workers in PROSA, the Association of Professional Social Work Educators in Higher Secondary, social workers working as counselors in schools, Kudumbashree, NRHM, etc. And also, the objectives of CAPS are to promote activities appropriate for strengthening and unifying the social work profession as a whole, to increase awareness about social work profession at various levels, and to enhance the public and professional recognition and identity of social work, to, to represent and advocate for programs and policies to meet the needs of social work fraternity and its various clientele groups, to contribute to the development of social work knowledge and research, and review the education standards of social workers, to advocate for the pursuit of social justice and changes to social structures and policies in order to promote social inclusion and redress social disadvantage, and also to promote and facilitate members' professional development and lifelong learning. And these are all about the three about Adi, Lockmans, and gaps. Father?
Yeah, we'll start. Ma'am has joined. Lida, ma'am. Oh, very
Sorry,
good. Welcome, ma'am. Welcome, ma'am. Just we are going to begin. Okay. Thank you, Dr. Lida Jacob IAS. Thank you for joining. So we begin with a prayer. Prayer is taken from Preamble of the Constitution, read by Ms. Uma Vadagotatara.
We, the people of India, having solemnly resolved to constitute India into a sovereign, socialist, secular, democratic republic, and to secure to all its citizens justice, social, economic, and political, liberty of thought, expression, belief, faith, and worship, equality of status and of opportunity, and to promote among them all fraternity, assuring the dignity of the individual and the unity and integrity of the nation. In our Constituent Assembly, this 26th day of November 1949, do hereby adopt, enact, and give to ourselves this Constitution. Thank you.
Thank you, Ms. Uma. Now I welcome Father Lenin Anthony to deliver the welcome address.
Dear friends, wish you a happy and healthy and prosperous New Year. Dear respected Dr. Lida Jacob IAS, Dr. Aib Verghese, Dr. Elizabeth Cheney, and my dear friends. Health is a state of complete harmony of the body, mind, and spirit. The human right to health means that everyone has the right to the highest attainable standard of physical and mental health, which includes access to all medical services, sanitation, adequate food, decent housing, healthy working conditions, and a clean environment. Dear friends, we have been giving importance to many other things like wealth, property, power, and other things. Once the pandemic corona affected the whole world, we have realized that health is the most important element in our life. So we have decided to organize a webinar on Right to Health in New Normal 2021. Today we have three eminent personalities with us to speak on this subject. But first of all, I would like to welcome Dr. Lida Jacob, IAS, retired, who is the president of Kerala Association of Professional Social Worker, who will be inaugurating this webinar. A few words about her. Dr. Lida Jacob joined the Indian Administrative Service in 1978. She has served as the Additional Secretary, Land Revenue, Director of Rehabilitation and Deputy Secretary, Labor Department, Director, Kerala Urban Development Project, World Bank aided, and Joint Secretary, Local Administration Department. She was the Collector and District Magistrate, Kollam, from 1992 to 94. She's also served as the Managing Director, Melma and ID Development Commissioner, Director of Public Institution, Trivandrum, Managing Director, Kerala Finance Corporation, Trivandrum, and Secretary Department of General Education, Government of Kerala, so and so on. Many things can be read. If you just open our YouTube or in the internet, we just browse. I think most of you know about Dr. Lida Jacob, very famous for many decades. So we very wholeheartedly we welcome Dr. Lida Jacob for this webinar to inaugurate. Secondly, I want to we welcome our two speakers, Dr. Ayub Varghese and Dr. Elizabeth Shaini. Dr. Ayub Varghese is the head of the Department of Social Work, BCM College, Kottayam, and the General Secretary of Kerala Association of Professional Social Worker. And he has got many degrees: MA Sociology from Agra University, MBA from India, Indira Gandhi University, MSW from Nagpur University, PhD from Agra. And he has several years of experience as a teacher, and also he was an nodal officer in Kottayam Childline. And of course, I am happy Ayub Varghese and Dr. Shaini, Elizabeth Shaini. I know her from 97 onwards, almost 23 years. And she has wide experience as an Ayurvedic doctor, more than 3 decades. She is working in Calicut and very efficient practitioner. So we have got both teacher as well as practitioner on health. I'm very happy to welcome both of them. From the bottom of my heart, I welcome Dr. Elizabeth Shaini and Dr. Ayub Varghese. And now I also would like to welcome the local partners before Chatapadi working for the rights of people. I welcome all of them. And I would like to welcome Dr. Joseph Sebastian, Working President of CAPS, State Vice President Mr. Abdul Rahman, Dr. Anish, Dr. Soni, Laila College, HOD of Social Department, Ms. Ashwiti Krishna, Executive Member Palakkad CAPS, who will be delivering a lot of thanks. And my dear friends, social workers, health workers, and on and all from different parts of our country, from different fields, there are many have joined. I am very happy to welcome you, and we'll have a wonderful time. And once again, welcome and thank you.
Thank you, Father. Now I welcome Dr. Lida Jacob, IAS, for delivering for inaugurating this webinar. I welcome you, ma'am, for inauguration.
Thank you very much. Thank you. Father Lenin, my good friends, Dr. Ayub Varghese and Dr. Shaini, Elizabeth Shaini, members of CAPS who are actually like family members to me by now, and all the participants in this webinar. I'm happy that Father Lenin Anthony has decided to hold a webinar on a very important theme, which is extremely relevant at this point of time. As he mentioned in the welcome speech, today, it doesn't matter whether you're rich or poor, it doesn't matter whether you're influential or just an ordinary person. What really matters is how healthy you are and whether you can survive, withstand this coronavirus. So it is mainly a question of being healthy, not only healthy in body, but also healthy in mind. We find that today's environment of fear, anxiety, doubts, a lot of depression, people are worried. People are worried about themselves, worried about their dear ones, and worried about their own future. This is because coronavirus, which has taken over the world and has become a pandemic by now, and is even becoming even more virulent with the new mutants of the virus. We are left with very little knowledge or very little defenses except the medicines that are known. And the vaccines have come around. They've been already being given to a lot of people. And hopefully the ordinary man in India, in Kerala, and all over the world will be able to receive this vaccine, hopefully. But before that, it is necessary for each and every one to build their own resistance, maintain their own health, improve their lifestyles, and live healthy lives, both body and mind. that is more easily said than done. Today I was talking to one of my friends who said that they have been actively walking around in the park, in the museum grounds for years. But now they are stuck in their flat. They cannot go out. They're an elderly couple past 60, but still they cannot go out. And how much can you exercise in the house? So they are worried about their physical fitness, which they had maintained for so many years. What do? We don't go out. And they have to manage whatever they have within their house. Similarly, they don't get to see friends. They don't get to meet their children. This is a situation that almost 75% of the population of the world is now being subjected to. This is the situation. So where do we start? I think the important thing is we have to give up old habits which are not healthy, whether they are in the lifestyle, in eating, in our maintaining relations with others, because mental health is of equal importance. Those of us in CAPS who have been able to interact with the authorities regarding the need for counseling, offering counseling support to persons who were in quarantine, persons who were having coronavirus, members of their families, we find that there's so much of tension, so much of strain, so much of anxiety, and all this stress takes a huge toll on not only the mental health, but very much on the physical health of the person. So we have to strike the balance. We have to go back to nature in some places, and we need to be also careful. Not only we, but our dear ones, our loved ones, follow a more healthy and a practically possible way of life and develop new ways of life. Be more open, think about others. And I think the best way to remain healthy is to think about others. And if you are able to support others, I think that would be a great help. And I do hope that this webinar will give you a lot of insights, because Dr. Aib Varghese, who's well known to me, will surely be able to give the required inputs, the required knowledge that you require. I am very happy about that. So also, I don't know Dr. Elizabeth Shaini, but I'm sure she's a competent person and be able to give us knowledge which we do not have regarding the natural and Ayurvedic means of staying healthy, as also developing strong personalities, strong, healthy lifestyles. I wish this webinar all success. I'm glad to be part of it, though for a short time. I've been rather busy these days. And I thank you for inviting me. And let me also tell Father Lenin that although I hope to get a PhD someday, I'm not yet a doctor. I don't have a doctorate, so I'm not doctor. Thank you for the promotion anyway, by the way. And Happy New Year to all of you, and have a wonderful experience. Thank you very much. With these words, I inaugurate the webinar on health issues during COVID times. Thank you.
Thank you, ma'am. Thank you very much. Ashwini.
Thank you so much, ma'am, for inaugurating our webinar. And now I welcome Dr. Aib Varghese sir for delivering the speech on right to health. I welcome you, sir.
Okay, thank you, Ashwini, and good afternoon, everybody. Respected Dr. Lida Jacob, Dr. Elizabeth Shaini, Father Lenin Anthony, and all other organizers of this program. I hope I am audible and visible.
Yes, sir. Yes.
Okay, and a Happy New Year to all of you. The good news on this new year is that we are getting a COVID vaccine, and it's already available and will be released very soon. Initially, the health workers will be getting that, and followed by the frontline workers. And regarding this particular session, I know there are many experts in this group listening to me who are much knowledgeable than me. So they may be able to contribute maybe after, once I finish whatever I wanted to share here now. My brief session will be covering especially two areas. One is initially some bits of COVID, the present situation, and then what should be the rights in the new normal. That will be I will be covering in these lines. Now, when we talk about a new normal, what is the meaning of new normal? We often hear this one, and what we understand, it's a new way of living. And of course, there are some definitions for new normal also. It's a state to which an economy, society, uh, that settles following a crisis. So whenever some kind of pandemic calamity occurs, we used to hear this terminology, new normal. And now we often hear this now in the situation of COVID. Actually, we were already in a new normal, especially work from home, in our gatherings, celebrations, and our economic and social restrictions. All these have led to a new normal for us. And as far as WHO is concerned, WHO says the new normal is to a new future. And considering the entire situation all over the world, this is what they have to share. And what we can see, a new normal with the vaccine, because we are hopeful that the vaccine will be available to all the people. So there can be a new normal with the vaccine, and at the same time, there can be a new normal without vaccine also. So now, and this new normal will keep changing. It's not at all that like if we set to a new normal, we will be stick on to that. No, that will be keep changing. We are wearing mask whenever we go out. Now, even without a government order, suppose even when the government lifts this ban or lift this restriction, still we will find people wearing masks. Before Corona, before COVID-19, when we used to see somebody is wearing a mask, people used to feel that, of course, that person is having some kind of serious illness. That was the thinking. Now that has changed. Now, if somebody is not wearing a mask, if we see somebody is not wearing a mask, then we'll surely think what happened to this person. He is antisocial. Otherwise, that's why he is not wearing a mask. So this way, the perceptions of the people are changing. And now we have virtual meeting as we have now, virtual teachings, and more working from home. That's another normal. Home deliveries, e-business, and more sanitation and more cleaning. Temperature checks whenever we enter to a new place, the temperature check is happening. So that's also really a strange normal. And the prices also are changing. These are all some aspects of or some dimensions of the present normal that what we experience now. Now, the situation of COVID as on today or as on yesterday, what we see from internet is there are 8 crores and 65, more than 8 crores and 65 lakhs of people have been affected with COVID all over the world. And 18 lakhs of people have died. 18 lakhs. It's not a small figure. Okay. And when we consider India, we have 1 crore and 3 lakhs of people. 1 crore and 3 lakhs, more than 3. It is now touching 4 lakhs are affected with COVID in India. And 1.5 lakh people died. 1.5 lakh people. It may be a population of a small city. So that much people have been vanished from our country just because of the COVID. Now, regarding this particular topic, what I feel is that this will be only an introduction because the time allotted is only hardly 40 minutes. Out of that, also 15 minutes are over, and we cannot cover. This is such a vast topic. So let's have some kind of introduction and getting into the topic so that you will be able to read more and listen more from other sources also. Now, the number of cases are not much reducing. I am just talking about a situation without vaccine. The number of cases are not much reducing. Why? And the main reasons that has been observed is the relaxed control measures. Now, yesterday onwards, our college, day for yesterday onwards, our college have started. I'm also teaching in a college. The students have started coming, especially my PG students have started coming. And it is very, very difficult for the teachers to implement any kind of control over them, to keep social distance or anything like that. It is very difficult. So we are yet to see the result. It may be available after a few days. So that's what the situation now. And of course, what I see in Kerala, most of the people are wearing masks. But when we talk to people outside Kerala, especially in Bangalore and other places, they say people are not even not interested to wear mask also. So that's the situation. And declining risk perception, that itself is another serious issue. The risk perception, that is also declining, because now people started thinking that it is not that much serious. Some people may have a flu kind of thing, a mild fever, and that will go off. So that's what most of the people think. So that is again another problem. And people want to return to normalcy. So they want to become normal. So they don't want to observe any kind of restrictions. And of course, reduced protection behavior. That's, we have already said that. Now, our ultimate aim, even with this vaccine, that is achieving a status of herd immunity. We know what is meant by herd immunity. That is, a population becomes sufficiently immune to infectious disease, and it will be no more spread in that community. So that is herd immunity. So we need to achieve that situation. Then only we can say that we are safe from COVID-19. Now, COVID-19 is comparatively low in Asia Pacific region. So that's actually because of a particular strategy that Asia Pacific region, the countries in the Asia Pacific region follows. They have a common strategy. But now, of course, we need to have more actions for mitigating the risk and minimizing the transmission of COVID. There is no doubt in that. At the same time, we need to maintain our social and economic activities, because we need to come back to the normal. Otherwise, it is going to hit our daily life. It is already hit, but the situation will be more severe in the coming days. Now, what I was mentioning, the colleges have opened, the youth have started moving without any restriction. Uh, some of the studies in Japan and all, in the July, August month last year, that was proving that because of the free movement of the youth and the healthy people, that has created a lot of problems there. The people are having mild symptoms, or they are asymptomatic. There is no symptoms at all. And these people will unknowingly spread the COVID to their co-workers, sometimes their co-workers, their friends, and their family members, of course, their fellow students. And it is very, very difficult to identify, even with expanded surveillance systems. Now, with improved testing and screening programs, and we need to have a better healthcare practice. Some of the worrying risk are because of the COVID. Now the people start talking about COVID, and only COVID is in front of us as a health concern. And all the health concerns have been somewhat neglected. So the vulnerable and the disadvantaged population, they have been neglected. The older people, somewhat they are neglected. The people with chronic disease. Kindly wait for a minute, please. Uh,
Yes, sir.
it was national anthem. The college time is over. Sorry that I forgot to mute. We started with a prayer from the Constitution, and it's good that we got a chance to hear the national anthem also in between our program. Okay, so we were talking about some of the worrying factors. So some of the population living in the urban areas or in under-secured rural areas, they are also not that much protected, or some other marginalized people having limited access to information about all these things and the services. Some of the seasonal diseases and chronic diseases, okay, that is already happening, and it is all merging with the COVID. So there is problem in addressing those things, and the mental health, maternal health, and neonatal health, all these are problems. Substance abuse, another serious area. And as our president has already mentioned, the risk of suicide, economic crisis, the mental stress, all these are happening. Some of the routine cares for tuberculosis or TB or HIV/AIDS, there is problem in that routine checkups. Then reproductive child health, there is problems. The deliveries, immunization, and of course, due to the engagement of this health workers in the frontline health workers in other activities. So all these are problems for us. Now, the National Human Rights Commission that has constituted an expert body or expert committee for studying all this, the impact of COVID-19 on human rights, and of course, they have come out with a long list of items and suggestions also. So, what they have mentioned as part of the human rights, access to free healthcare to COVID people and non-COVID people, that is also there. Then access to testing, then access to transportation of patients, that is very important. Access to cashless payment, digital payment, then display of patients' rights. That is also part of the human rights, especially in the COVID situation. And of course, display of patients' rights and responsibilities also. There should be a system for grievance redressal, then right to information for a patient, means all the details about the treatment and all the things, the updations, everything should be made available to the patient also. Then availability of medical services, that is another right. Proper medical services should be available. Then there should be transparency for the rates. Then COVID dashboards should be there with all the details. COVID help desk should be there. This is all instructions to government. Then integrated disease surveillance program should be implemented. And there should be timeline even for reports. Suppose somebody is undergoing a COVID test, there should be, the time should be specified within which that report should be made available to the patient. Then the patient should be treated with dignity and respect. The confidentiality of the problem, I mean the disease, or confidentiality about the name and other details. Then the non-discrimination, to let the patient be from any background, they should be treated equally. Then important drugs should be available, and facilities in the quarantine centers. Okay, even the report says that there should be adequate compensation for those who are undergoing the trials for the vaccine. And there should be patient education through mass media. Of course, social workers can involve in many of these aspects. And even that human rights document touches the salaries of the people who are involved in the activities. So this is the situation of whatever Human Rights Commission has covered, especially on the basis of COVID-19. Now let's see what should be the new normal. Let us listen to Mahatma Gandhi's words, especially in the field of healthcare. What Mahatma Gandhi said is that that is very much applicable in new normal. Healthcare, the concept of healthcare should change to health for every individual. And the healthcare should change from metros to the towns, the smaller towns and villages. There should be generic doctors, then the specialist, then more importance should be given to public health, not to private health. These are some of the imagination of Mahatma Gandhi. And actually, what we are talking or what we are thinking in the new normal is exactly the vision of Mahatma Gandhi. And we should think on the basis of especially access, affordability, and specialist treatment. These are three important areas that we should see in the new normal, especially when we talk on the basis of health. Accessibility. So our Niti Aayog, we all know that our 5-year plans have been replaced with Niti Aayog. So they have proposed a national health stack, that is NHS, that is virtual, rather digital, that comprise of telehealth activities or telemedication. Why this is required? You know, we are in the digital era. There is no doubt. We cannot go back. Many of our services have been in the digitalized platform only, and that has been used by even rural people or people from any parts of our country. Many of our services are available only in the digital platform, right from booking of gas and paying of telephone bills, let it be anything. Most of our services are now changing to digital platform. Now, in the one of the study conducted by Mr. I forgot his name, he's from Karnataka. The study shows that 75% of the villages in India have a healthcare facility. 75% in India. 25% are still not having. But out of the 75%, 68% of the systems are not having any formal education in the medical field. That means without any medical training, they are treating the people. This is happening in 68% of the villages out of the 75%. So this is a very serious situation. You can see. Okay, and so the most of the people say that technology is the only solution, because with the technology we can have access to all corners of our country. And national digital health mission that plans creating a national health ID for each individual in India. Now we have Aadhaar. Okay, we have Aadhaar card, we know. Now we will be having a health card also. There are different systems already, programs are there, some projects are there, health cards are there. I'm not talking about that. But all the individuals in India will be having a health card very soon. And of course, there will be electronically medical reports will be generated, sharing of health records will be there. And there are so many things. Okay, accessibility means we need not to go to the hospital. The hospital will come to you. The hospital will come to your home. And even the technology will permit us to manufacture some of the, small diagnostic machines, which can be sent to your home, and diagnosis can be done at your home. And the report will reach to the doctor who is sitting in the hospital, and he will be able to prescribe. So that is the future. So that is the future health or health situation. We are into that almost. Okay, so that will be a normal situation. Maybe very soon we can practice that, and very soon we can see. Now, but the reality, the present reality, again, it is strange and very critical. Our former president, Pranab Mukherjee, in an article that was in 2019, what he read is 6 crore people are becoming, they are entering into poverty only because of their treatments. 6 crore people every day, every year in India are entering into poverty because of the treatment expenses. This is very serious. So here the requirement of public health and the need of public health arises. And let's go to the second part, that is affordability. Actually, this part is the point which I said just now is part of affordability. Earlier we have experienced that even for a COVID checkup, it was 4,500 rupees with government subsidy. Now that is again coming down. There is no problem. And of course, it is free for Ayushman Bharat card holders. The cost of ICU, thousands of rupees. You may have to pay thousands of rupees. So now that is being reduced in the sense new systems have come up where you can stay at your home. So most of the people are staying at home now. And how can we reduce the cost? First of all, early screening. Early screening is required. And with the support of digital platform and the support of health workers, there need not be a doctor. There can be a chain of workers. So this is possible to reduce the cost. So the concept of care cycle comes here. This is very important in the new normal and a care cycle. So this is not actually same as diagnosis and treatment. And this healthcare includes medical care and preventive care also. Okay. So this preventive care also becoming very important in the healthcare. Now, this care cycle will consist of certain people, like or certain concepts. We can say that it rather includes promotion and awareness, and it starts with diagnosing, then contextual evidence, then doctor-patient relationship is there, maybe online, then treatment, management, rehabilitation, and a continuation. Okay, so this is a care cycle. This is a new concept, and half of the job will be done online or without the physical presence of doctor. And many people have to come to the e-platform. Okay, and the treatment will be based on the expectation of the patient and their needs, not on the basis of what the doctor desires or what the hospital desires. So this is exactly a change. So there will be teleconsulting, there will be tele-ECG, there will be tele-echo with the small machines or portable machines which can be carried to homes. So that is going to be a new normal in the health situation in the very near future. Okay, so we can't expect everything to continue as on now. Nothing is going to be like as it was before when the entire COVID situation is over. Okay, now there may be some privacy challenges. So government is planning certain laws also in this regard in the healthcare sector, giving individuals to own their entire information. Okay, now I will wind up with one or two small concepts. What is WHO self-care? Because I am sure that Dr. Elizabeth will be talking more on this particular subject. The self-care on the WHO. So this is the ability of individuals or families. There is a beautiful definition. Ability of individuals, families, communities to promote health, prevent diseases, maintain health, and to cope with illness and disability with or without support of a healthcare provider. So here the individual becomes more important. The definition makes the entire system concentrating on the individual. So this is going to be the way of life. So the individual will be capable of promoting health, preventing disease, and maintaining health, and cope with or any disease or disability. Okay, so that is going to be a new normal. So we can say, of course, self-distance is self-care. Okay, and there are a lot of concerns that is also related to this one. Equitable distribution of healthcare and resource allocation problems. All these are part of, the system. So in order to continue the sustainability or the health sustainability, we need to associate with the government projects and the public health system. And we need to equip ourselves in the digital platform. Of course, we cannot say that 100% everything will be digital because there are also problems in that. But the fact that the number of doctors are very less, or the ratio of doctors are very less comparing to the actual requirement, considering especially the population of India. So this week is going to be the future. So in the health also, as this year, the social workers international theme Ubuntu. I am because we are. That is also applicable in the health sector also. That's what I feel. Because my health is because ours health. Our health. And our health means we all are striving together, working together for maintaining the health of individuals as well as maintaining the health of the community. So this is what going to happen, and this is an African concept. Ubuntu is an African concept which can be applied in many parts of our life. So that will be growing together. That is CAP's motto, growing together. So then only we can achieve the status of a community health or health for all in the near future. So the new normal will be changing, and we can see a lot of changes in the coming days also, because last week we have opened up so many things and we are yet to see the effect of those things. So let's now listen to Dr. Elizabeth also. Thank you, Father Lenin, for this wonderful opportunity. And as I have mentioned in the beginning, this is only an introduction to the topic because the topic is too large, too wide, and we need to understand more. We need to read more. I am hopeful that I have just given a trigger for you to read more and understand in this topic. Thank you so much. Thank you everyone for the patient listening.
Thank you, sir, for talking about the right to health in new normal. Now you can join after the discussion after Elizabeth mom's talk. Now I welcome Dr. Elizabeth Shiny, madam, for deliver about health in new normal 2021. I welcome you, ma'am.
Can you hear me? Am I audible?
Yes, ma'am.
Could you keep the mic nearby? Not that clear.
Okay. Yes. Thank you, Ashwati. And good afternoon, everybody, respected dignitaries and delegates. Let me thank the organizers, especially Anthony Achin, for giving me this opportunity. I'll share some slides. We are in the new era of new normals. A small microbe has overturned our routines, habits, and even the lifestyle we followed till yesterday. We are struggling to cope up, to standardize new ways to deal with the pandemic. Dr. Ipogis has elaborated much about the new normals around us. I shall focus a little bit on the health sector, especially personal health or individual health. There are so many guidelines prescribed by different agencies. WHO has issued a set of guidelines government authorities are periodically doing. Please remember that COVID is still here. We need to continue SMS. That is soaps, masks, and social distancing. We still need to protect ourselves. All of you are aware about these instructions. The need of the hour is practicing them religiously. I hope you can read this.
Yes, ma'am.
Okay. Let us review these one by one.
Previous one.
Okay. Coughing and sneezing, especially in public places, always cover yourself, not with your hands, but with your elbow. We have to practice that. Naturally, our hands will move to our mouth when we cough and sneeze. At first, we have to practice to cover with our elbows so that we don't touch with our hands again to our face. Okay. No need to repeat about the importance of washing your hands with soap. We have seen it again and again everywhere. You have to wash our hands frequently, at least for 20 seconds. You have seen the pictures of washing your hands, including every parts of your hands in between your fingers, like that. You have to wash your hands frequently. Social distancing in public places, at least a minimum of 1 meter from each other. That I think we should develop a conscience about these things. Social distancing and washing our hands, like that. If you are not well, if you're feeling unwell, you should not, please don't venture out. Stay home. That is very important. Don't avoid mild symptoms, even mild symptoms. You have to stay inside. And when you have any difficulty in breathing, consult a doctor. If it is possible, monitor your oxygen level. Avoid 3 C's. That is, what are they? Closed spaces, crowded places, close contacts. Places that might have close contacts. That if you can, please avoid. There are different ways and means to limit your personal contacts with outsiders, like accept door deliveries, prefer online cashless transactions, banking, online banking, through online banking. If it is possible, you can use these modalities. A number of online facilities are there nowadays, be it purchase of groceries, eatables, medicines, or online consultation of doctors. Many of our local vendors have risen up to the occasion and doing the home delivery now. We can help them also through a phone call or online booking. We can order even from our nearby vendors also. E-Sanjeevani is a wonderful initiative by central government. Now Kerala government is also opted, here also it is available. We can consult a doctor online. Just OP consultations you can do through this app. And after all, even if you have to, in case you have to go for shopping, please remember to strictly follow these guidelines, the given guidelines of keeping distance, like not touching your face with your hands, and like that, all the given guidelines. And after shopping, you disinfect the items you have purchased by wiping or washing, and you properly wash your hands. After that, even after receiving an online delivery or even a mail, after receiving it, you have to wash your hands. We should be very careful in following these instructions. Risk factors of COVID mortality are many. Many of these comorbidities of COVID are our lifestyle disorders, like diabetes, hypertension, hypercholesteremia, cardiovascular complications, obesity. All these are lifestyle disorders, and these are working as comorbidities of COVID, and it will increase the risk factors of COVID, like and some respiratory diseases like conditions also will increase the risk of COVID. COVID-19 is going to stay here for more time. All of us need to play our part. Right actions from our side will save the lives of many, especially the most vulnerable ones around us. So you have to be careful in these things. When you feel sick, stay home. That is the most important thing, I think. And you have to be careful about avoiding touching your face without washing. Cough or sneeze into your elbow. Clean your hands frequently. Keep distance, at least 1 meter distance in public places. Avoid crowded places. Limit your time spending in enclosed spaces like AC rooms. If it is necessary, you go there, but limit the time you are spending there. Frequently touch objects like your phones, your mobile phones, door handles, or like that. You have to clean it frequently. If you are responsible for communal spaces like shops, restaurants, place of worships, like that, you need to take care of these things. Ensure ventilation, proper ventilation to that place. Physical distancing. Provide the facility for physical distancing, hand washing, sanitizing, etc. You have to take care of these things. We have sacrificed many things during the past few months for our safety as well as our community. We need to continue this in the coming days too. There is no way out. We have to continue the safety measures we have taken up to this day. We have to continue the same way for at least for some more time. We need to do whatever we can to prevent the virus spread. That is our duty for the sake of humanity. Let us be the role models by practicing than preaching. Whatever is told, we have to practice. Whatever said so far are the general guidelines for individuals given by WHO and other global agencies. So now some tips from my side as an Ayurvedic practitioner. We are going to be homebound into 2021 also. So much noise all over, TV channels, social media, digital platforms. Let us take a break from all this or minimize our engagement for some time to keep our mind calm and peaceful. Find some hobbies or like some diversion from these all noises. So most important, you need to take care of your body. Your safety, your health is your prime responsibility of everybody. For each one, you have to take care of their own health. That is their own responsibility. Here is a food pyramid. We learned about a food pyramid that is normally major portion will be of starch. Our like for diet practices are also, we use major portion a starch predominant diet we are used to. So it will be helpful if we can change our diet to more vegetables and fruits, like that. We are like we are our activities are came down, our mobility is restricted, so I think less starch will do. Starch is the one which give energy, so we have to take care more about our body. So we have to concentrate on body activities, like that. Vitamins and minerals should be there. We have to, this food pyramid, it will be more helpful, I think. Vegetables, fruits, seeds and nuts. Not, don't go for much costly nuts and that. Whatever is available in our circumstances, we can use, like milk. And you reduce the consumption of salt, sugar and oil, like that. Avoid snacking, reduce junk food. So change your diet to a more healthy one. And with that, I suggest some things, spices and some more things we can use in our daily diet, like turmeric, ginger, pepper, lime, honey, tulsi leaves, like that. They can be included in our daily diet, like decoctions or in powder form or as syrups or like that. Use of some Ayurvedic medicines like ashwagandha. You all have heard about that. Ashwagandha will build up your immunity. Ashwagandha in any form, in powder form, there are in decoction form, everything is available there in tablet form or like that. You can use ashwagandha in daily basis, like one Vilvadi pills that will be available in any Ayurvedic clinics that you can use to build up your immunity. Indugandham Kashayam, that also you can use as an immunity builder and metabolic correction. And there is one medicine that you have to use as with prescription or like Ayurvedic medicine.
Yes.
That Deshamula Kadutrayam Kashayam, that is also available in any clinic, that you can use to clear your lungs. That will work as an expectorant. Whenever you feel a congestion, you can use that. Don't wait. If there are other symptoms, if there are, you are an asthmatic one, or on if there is no fever or symptoms, you can use that also. COVID mainly affects your respiratory systems. You need to daily practice some breathing exercises and yoga to strengthen your lungs. I think I can show some exercises for you, like pursed lip breathing, huffing and coughing, coughing in prone position, pranayama, like that. Can I show now?
Yeah.
Pursed lip breathing is, you can practice anywhere inside your room, straight, sit straight, in erect posture, and inhale through your nostrils, like this, and exhale slowly through a pursed lip, like this. Take a deep breath, hold it for some time, and exhale slowly through a pursed lips. That you can practice for some time. And huffing is like inhale through your nostrils and forceful expiration through your mouth, like this. Huffing. That also you can practice for some time. Coughing. Coughing, that will help to clear your lungs. For that, you inhale through your nostrils and start coughing. Like that. Like that. You can do this coughing in a prone position. Prone position, in like you can lie down with your hands and lie your head on your hands, and if it is possible you can lie down on your knees, like in a slanting posture. Your back will be in a slanting posture, and you can practice that coughing in that prone position, like kneeling, lying on your prone position and coughing. That will help. If there is any secretion in your lungs, you can clear it out. It will come out. Some decoction with tulsi or ginger, dried ginger, pepper, like that, that will help this to dilute that secretions in your lungs. And after that, this coughing in prone position will help to clear your lungs. Like that, you can lie in the prone position and again breathe in and do the coughing. Then your lungs will be a slight upside down, and the secretion in the lower lobe of lung can be cleared out. This you can do in a daily basis. And you may be heard about pranayama, that you sit in a erect posture, and you can close one nostril, inhale through the other nostril, and close the nostril and hold it for to what time you can hold it. There is a time proportion, but at what extent you can hold it, and slowly exhale through the other nostril. Again repeat it, reverse. Inhale through the other nostril, close it, hold it, and exhale through the other one. Again repeat it. There is a proportion for this inhale, hold, and exhale. 1:4:2. If you can, you do like that. Otherwise, you slowly inhale, hold it as much time as you can, and exhale slowly. And using each nostril at a time. Inhale through one nostril, close it, hold it, and exhale through the other nostril, like that. These breathing exercises practicing every day will help to improve your lung health. That will
Dr. Elizabeth, we lost your audio. Meeting coordinator, please help.
I think she has left. Anthony, Father Anthony.
She will join.
Yes.
Maybe got disconnected.
We'll wait for some time. Yes, she will try to join. Sure.
Meanwhile, you can ask Father Dr. Rai Varghese any question, any clarification if you have.
Yes, I have two questions on mind.
Yeah.
The very first question is about the mask. Now, very soon after US discovered this, pandemic, there was a driver who was wearing a mask and driving a car, and he fell down. He fell unconscious. He went and bagged into a tree. Now, this was because what he was exhaling, the same thing he was inhaling. Now, how far is this correct in, as far as this advice is concerned to wear a mask? Number two, I would draw a line from Gujarat to Calcutta, right? Above which India is divided in two parts. Now, above this line, nothing is practical, or it's not wise to go ahead with that. Yes, down the line, we all can take care of it. Now, these were my two questions. Because when it comes to political rallies, nobody is bothered about social distancing. But when it comes to a congregation, everybody puts the eye upon social distancing, which is really refuted. I hope you will agree with me. Thank you.
Actually, the questions are more of, the second question is more of social in nature, that requires a political will, because after all our political parties are behind the power. So they will not stop. They're not going to stop in India. They're not going to stop any political activities or any political gathering. Actually, you don't have to draw that line, sir. I mean, dividing India to north and south. Wherever you go, the political will remain same. That is applicable right in Kerala also. Of course, earlier there were some restrictions in gatherings, but recently we had elections also. And on the final day of that election propaganda, what we saw is all are coming together. Actually, Kerala expected a large scale, COVID spread during that time. Anyway, I don't know, by God's grace, or whether the numbers are hidden numbers, because whatever the numbers we see also, that is not the actual number. There is no doubt in that. Practically we know. If we say that 1.5 lakh people have died, the actual number may be double that. And if we say that 1 crore people are affected, the actual number will be at least 3 times larger than that. Yes. So your second question can be only with the political will. So we may have to change the entire system, that we may not be able to at the moment. And regarding the first question, anyway, that's a threat. Actually, what you shared is a threat. But there has been no cases in India in this regard. But what we are inhaling, that is actually the thing. The problem or the solution is that you change the mask also. Maybe one mask in a day. Otherwise, there are masks available. Reusable masks are available. We may have to go behind that. Of course, that is again touching our finance also, but can't help. That has to be. That's a part of new normal again. Now the thing is that masks are available with the dress material you purchase. Especially you see when we see the ladies are wearing the saris or churidars, they wear a similar mask also.
Matching.
So every time the marketing strategy is such they're producing and they're, I mean, supplying the mask, similar mask also. So in that case, every day they will be surely changing because they have to see the matching color and all those things.
No, but what we breathe, we breathe what we exhale, we inhale. Now, whether we change the mask or not, that doesn't make a difference, Father. The problem is that over a period of 6, 7 months, we will definitely succumb to pneumonia in that case. Because, the air, the quality of air, what we inhale must be pure and fresh. Whereas we are still inhaling that warm air which we have already exhaled.
There is actually, sir, another dimension. What you said is correct. I too accept it. And of course, we may have to wait for some more research studies and results. But the study is also proving that by the use of mask, the normal problems like, the cold and cough and similar kind of things are that have been reduced. Okay, reduced to, even 25%. So that's why the people were not going to hospitals. Otherwise, people are ready to, treat at home itself. So these are some of the positive aspects also. But we cannot neglect the point, whatever you have said. We may have to wait for some more time to get some research studies on this basis. That's what I feel.
Dr. Aip, we have been using the mask for more than 9 months, 10 months now. If the argument is to be true that thousands of people should have died now, by now, maybe 1 or 2 people had the accident because of wearing the mask, which we are not sure because of their, their exhaled air is being inhaled by the driver. It happened. It can happen many other things. Otherwise, so many people would have been. No, people have been traveling 24 hours and 24 hours they were wearing.
Yes.
So that the argument will not hold good in terms of a larger number.
The problem is, one sec, Father, when I travel across India, building roads, I have seen in Orissa also, Orissa, Panchmahals, especially where there are tribals, Bhils, they are not bothered about mask and they are healthy now.
Sure. The immunity is much higher in the poorer people because they are in touch with the world. They are not wearing our slippers. Most time they are in touch with the mud. If we apply the mud every day in the morning in our body for some time, that's the naturopathy tells us today, no? So it has a natural immunity, whereas the rich people don't touch the earth and they don't have the natural, immunity. This can happen. That if you look at even in India, the slum people have not died in terms of number. People who have died are more on middle class and rich people, no? And why the Europe and America has more death than the Asian countries? Simply as that.
The hi-fi.
Yeah, and actually, what Dr. Elizabeth is sharing about the breathing exercises and all these breathing exercises are automatically, naturally happening with the poor people because they work hard. Okay, morning till evening, they work hard, and that breathing exercise already that is taking place. So that's a natural precaution. That's what we can say.
So Dr. Shiny is back, so she can continue. You have to unmute, Dr. Shiny. You are muted.
There was some network problem, unexpected.
Okay. We managed the time.
Thank you. Breathing. I heard about what Ike Verghese sir was saying about breathing. Okay. As working class people, they are having proper breathing care, but others who are constrained at home and they are not properly exercising, for them it is a must and it will help them a lot. especially somebody with respiratory problems like asthma and allergic problems. They have to practice it regularly. It will help them. And if outdoor activities are not possible, we have to start some exercises at home, like walking inside the house or around our house, or jogging on the spot, or some can start practice dancing, or any exercise, yoga or any exercise you have to practice regularly. I think this period of time you can utilize for improving our health habits, like starting an exercise. Most of the people I know, they are not regular with exercising. They may do some, but not regularly. I think regular exercise will help your health tremendously. And one thing, like Ibergi sir said, working outside, people they may be getting sunlight, but some sun exposure will help. All are constrained at home and they are not at all exposed to sun, and some exposure to sunlight for some time. We can do some activities like gardening or walking in sun. That will help to improve your general health, to improve calcium absorption and like that. These things, exercise and sun exposure is that I suggest them also. And one more thing, good sleep. That is a very important thing to give rest to your mind and body. You should get it is recommended to sleep for 8 hours, at least for 6 hours. In our older generation, people are not that compulsory, but nowadays it is recommended like that. A good sleep for at least 6 to 8 hours will help your general health, like repairing your body and give calm to your mind. And take some time to unwind your mind. COVID has provided you sufficient time to restore your broken relationships, be it family, relatives, colleagues, friends, or anyone. You should not feel that you are left alone during this stressful period. There is a lot of stress when you go through the present day ordeal. When you think about the future, your mind needs some relief. So find ways and means to unwind. And towards conclusion, always check the reliable sources regarding the COVID information. Keep the emergency contact list readily available. If in chance of an emergency, an emergency contact list should be readily available at your home or your workplace and all. Kerala government has come out with excellent portals and dashboards for providing reliable information and emergency services related to COVID. Psychosocial support helpline numbers are there for each district. If there is any need, the helpline is there. We are in the midst of a pandemic which has not spared anybody. All are undergoing financial difficulties, losses causing great distress and trauma. Our youngsters are worried about their future. So talk with them, especially with youngsters and children. Give them confidence, emotional health is the top priority. Give them emotional support. I just want to conclude here with this positive note. The situation may be overwhelming, but coping with stress will make you, the people you care about, and your community stronger. Thank you, everybody, for the patient listening. Thank you.
Thank you so much, Elizabeth ma'am. Now we can have a discussion about the topic. We already started a discussion during when you left from the meeting. Now we can continue with that. If anyone have any doubts or anything to share, you can please ask to ma'am or Ait sir, or leave it in the chat box. We will ask it to them.
Feel free to ask in any language. Malayalam or English. ചോദ്യങ്ങൾ മലയാളത്തിലും ചോദിക്കാം. You can give translation. Father Joe James also is there. Father, welcome, and you can ask a question. We have Dr. Bhaskar from Pune, our companion. We have people, many VIPs are there. They can ask questions.
Hello, thank you, Father P.S. Yeah, I'm Bhaskar from Pune. As you all, I have one general question that as you are aware, Pune is one of the hot spot of this corona, and previously, previous 4-5 months, we were very strictly observing all these mask, sanitizer, and all those things, and that time the patient were increasing day by day and every day, but now we have seen people are not using masks, or there are a lot of gathering and all, but this number is decreasing. So we have, means I have doubt, so is it how it can happen, or if you have any answer, so please, this is my simple question. I hope I am clear. Father?
Yeah, either Ait sir or ma'am, Elizabeth ma'am. One
Yeah.
of you can good answer.
I think the number of testings might have come down, one thing, and a type of herd immunity can be happen in that community. That can be, and vulnerable percentage might have infected already. And I think even if some percentage of people are not using masks and not following the protocol, but the elderly and children are, I think they are not going much out like that. They are protected. All these factors can be helped. So this is not a sign to come out of all the restrictions. I don't think that will be helpful.
Okay. Thank you, ma'am. Thank you.
Matthew Arthel, about Dr. Ives' class. I liked what you said about what the report of Human Rights Commission and Gandhiji's vision about health. And also the data you gave that about 68% of the health workers in India are not qualified. So such important informations and analysis you gave. And Dr. Elizabeth's
one point I would like to clarify. It is not that 68% of the health workers are not qualified. Actually, the initial figure is that 75% of the rural
area. Oh, I see. Not the whole of India.
75% of the rural area are having health service. Out of that, in that rural area, out of the 75%, 68% are not.
Thank you for the clarification. So that way, information what your class was impressive and helpful. And Dr. Elizabeth's practical protocol, what we have been hearing, but I think in a new way you have presented, and it was helpful for us to again to be reminded ourselves of it. My question is about the revival of this new virus, new type of virus coming up again. As a result, the today's paper also said England has declared lockdown again. Germany and many other European countries have started lockdown again. So, is there not a possibility here in India and in Kerala also, this in other states, this situation coming, if not now, in the near future? And therefore, what should be our extra care we should be taking?
Already reported, Father.
Already reported, Kerala. Yeah, that is true.
In Calicut itself, it's already reported. And there is a chance. We have to anticipate all this, and that is the same answer. We cannot stop any protection protocol, no relaxation. Even if government give relaxation, we have to be careful. Each one have to take the personal care. You have to take care of ourselves and the surrounding people, your home and around us. We have to take care. We have to keep the same protocol. More than that, anything, I don't think there is nothing we can do. So we can improve our individual health practice, health to improve our immunity and general health. Like with exercises and diet, we can reduce our chance for lifestyle disorders. If we are already diagnosed, we can control our conditions into a healthy, to improve into a healthy condition. Like that, we have to take care. I don't think government or anybody can take any measures if virus is started, or a new virus can come, more disastrous microbes can be. We have to expect all that. There is nothing more. We have to be more careful.
Yeah, correct.
Sir, the effect of relaxing this lockdown, especially opening up the schools and colleges, we need to wait for another 1 week. What will be the effect of this one? Because the student population, they may not be keeping the physical distance of whatever amount we tell them. That is not possible also. So even today also, I had to send 3-4 students back to their home. So if one person is suppose identified or diagnosed positive, then the whole class or the whole college may be closed. So let's wait for another 1 more week, and let's hope the vaccine will work out well. That's the thing.
That will take some more time.
Yeah.
European countries were giving more relaxations, and now that is the effect of that. London.
Yeah, exactly.
So we have to wait.
Sir?
Yeah.
As a professional social workers, there are many social workers are attending. What should we do? I mean, as a social workers, especially because people, normal people, we should have to concentrate them, or we have to. We cannot just sit inside and keep mum. We have to. We are with the health workers, doctors. We should also, I mean, properly give awareness and other things. What are things we should do? That's my question.
Actually, sir, the point shared by Dr. Elizabeth, that is valid here. And as far as social workers are concerned, from the beginning, that is from the March itself, we have been in the field. Okay, supporting the health staff and undertaking a lot of activities. In the month of April itself, more than 1,000 social workers across Kerala, they were voluntarily working. That means, especially in the field of preparing IEC materials and spreading the information to the grassroots level. That is where the social workers, the role of social workers become more important. And we have supported the government and also otherwise also the social workers, the district chapters and our state as a whole also, we have initiated a lot of support programs, counseling services or other mental health programs, so that the people can contact us and share their problems, and we try to solve the problems. We have been acting as a link between the government and the public, because there are many places where the information from the government is not reaching to the people at the grassroots level. So in all the places, we have been a link between the government and the public, and we have been acting as an advocate for the people in need. So especially with the migrant population, elderly population, in some parts women, and the tribal communities. So like that, in many places, the social workers were actively evolving, and now also in many places it is continuing. And especially in some of the districts like Kottayam, there were some other projects like Karamtoda, the Kadutari, where the government has initiated, the health department has initiated the people in quarantine. They were formed into different groups in the sense panchayat-wise groups, WhatsApp groups were formed, and when anybody is coming in quarantine, they were added into this group, and in all the groups 2-3 social workers were also added, so that they spend a good quality time, and all the precautions were shared, informations were passed, and of course the social workers have encouraged the people to spend their time in a quality way by preparing. Even the collector also has shared a lot of items which the people in quarantine has prepared. The collector has shared in their Facebook page. So like that, so making the life of people more comfortable. That was even though there is physical limitations, the social workers encourage the people to have social relationship, to maintain the social relationship. And of course, now also it is continuing by, working in the field of disseminating the knowledge and information. It is there. That's what we are now telling our students also. So the role of social work is very significant in this type of situation. But at the same time, we also have faced challenges because of the because we are not able to reach the people physically. So that was a challenge. Somehow we tried to overcome that through online media.
Thank you very much, sir. Thank you. In chat box, any question, Ashwini?
Actually, now this we don't have to call this new normal anymore, because this is the normal now, and this will continue, maybe with the slight changes. So we have to adapt to this one. Especially the elderly people, they may have problem in dealing with the digital technology. So that the government has to take care of such situation.
Father, we don't have any questions in the chat box.
പക്ഷിപ്പനിയെ കുറിച്ച് ബേർഡ്സ് ഫ്ലൂ കേരളം മുഴുവൻ it's spreading, no? How do we tackle this COVID-19 and this birds flu?
Relating to COVID morbidities, bird flu won't affect humans that much. So I don't.
It's not a pandemic, just it is like
Actually, that's a situation we often face at least 2-3 times a year.
I think COVID protocol has to be continued, and bird flu, like directly, it won't affect human beings. It won't affect. So I don't think that is a scary situation. That is not a scary situation. Government will take enough measures for last time also, it was last year also, even
it was
repeatedly we are facing it.
Hello, ma'am.
Yes.
Okay, will the coming of vaccines change the new normal back to normal?
That we have to see. Nobody's experienced it. The whole world is waiting for it. Nobody can assure that that vaccine will come everything to normal. So I think we have to accept this as the normal, as Sir said.
Okay, ma'am.
Actually, what I feel, some of the things in the new normal is good also.
Good.
Yeah. Oh, yes.
So the people will have self-control, more self-control, and a care for others, a sharing mentality.
Yes.
Limiting our expenditure. One of the problem in Indians have, or especially Malayalis, and more in India, the main purpose of the life is accumulation of wealth. Accumulating wealth for the coming generation. Okay, so that's why they are doing anything for accumulation of wealth. That mentality or itself will, reduce. So there will be a lot of changes. We can see that, and all the marriages what we see now, again it is going back to the normal. Marriages. Earlier marriage was only a single day. Now the marriages are conducted in there are 3-4 receptions every day. Calling.
From 1 week had people every day each they were invited.
Shows how people never learn. But most of the cases they are asking for only prayers. That's a good sign.
Okay, sir. Thank you.
Raju, you want to ask something?
Connected with a new vaccine, I heard in media some expert doctors saying even after taking the vaccine, you will have to wear mask and other thing precautions. Yeah, it is not 100% guarantee that you won't get it.
After getting the vaccine, you have to continue with the protocol for
protocol
sometimes it is at least
that's what I was saying that
it proves that we have we are getting enough immunity.
Yeah, even though it has been tested, it's not a proof like as in the situation of other vaccination or other immunization that we normally have. Okay, so this will take time, and of course, once the world has lost about 18 lakh people died out of COVID. So it was a mandatory thing. They have to come out with the vaccine because the whole world was watching for that, and the actual result, we may have to wait for some more time.
Came out in a hurry.
Yeah, sure.
Yeah, usually take some more time. And the other thing, this virus is undergoing mutations. So even if so far they are saying it is effective. So we'll hope for the best.
If anyone, we have different persons, different parts of country, people are there. If nobody has questions, we should conclude. If anyone has any question to either to Dr. Aipagis or Dr. Elizabeth Shaini, you feel free to ask. We'll have 10 more minutes. Meanwhile, the feedback form is given in the chat box. Each certificate will be given all who fill the forms. So meanwhile, 10 more minutes we have. You can ask or interact with our resource person. If no one has question, we will ask Ms. Ashwini Krishna, the executive member of Kerala Association of Professional Social Workers, will propose a vote of thanks. Friends, we have one YouTube channel called Adi Srishti, AADA, STI. All the webinars, almost 13 webinars we had all together. Everything is connected to human rights and so on. You can watch in our YouTube, Adi Srishti. And this also is recorded and it will be there in our YouTube channel. And we feel very happy. Ashwini Krishna, who completed a MSW from Amrita. Yes, she will propose the time. Yeah.
Good evening to all and all gathering here. On this wonderful evening, I would like to present my vote of thanks. We take golden opportunity to thank our chief guest, Linda Joseph, IPS officer retired. Thank you, ma'am. Inaugurate our program. Then our chief guest, Dr. Elizabeth Shaini, Ayurvedic Health Center, Kottayam. Then another our resource person, Dr. P. Gis, sir, head of Department of BCM College, Kottayam. Thank you, sir, for your all participation and your all support and discussion. Actually, I didn't see complete discussion and I didn't see the seminar. Just for your 10 minutes and last minute I'm attending. But last 5 minutes I'm very happy to hear your all discussions and all your points. Very valuable points, sir. I'm hardly thankful. Then Father Pierce Lane and Dhoni, sir, our backbone, sir, always thanking you, sir. Then our supportive organization, Lakman parts and Lakmach my participants and Kerala Social Work Association Palakkad chapter. All good, sir. I'm heartily thanking you, sir. Thank you. Thank you all. Then another all participants, social work students and professionals, teachers, all I'm hardly thanking you, all your support and participation. Thank you, sir.
Thank you, ma'am. Thank you, Ms. Shruti Krishna. Friends, those who are attending can fill the form. Meanwhile, if those who have any doubt, kindly ask. I request the resource person to remain 5 more minutes. If anyone wants to interact with you, and kindly you can get their number also. Elizabeth Shaini, Dr. Elizabeth Shaini, as well as Dr. Iceberg is you can get their number. Those who want the PPT, I can also give. She has already shared with me. We can give. For Joe James, I think for Joe James has left already. Anyone wants to say hello, hi to them, please feel free. Elizabeth ma'am, for there?
Hello.
Yes. Yes.
I'm here.
Yeah, brother, you can ask anything you want to, you can comment or give feedback to both of them.
Yes, Father Anthony.
Yeah.
Thank you very much for organizing this webinar.
Yeah.
I also thank the two presenters who presented this the topic, a very good topic related to human rights. For me, one question will always remain is to changing the mindset of the people, especially in the rural areas where we are involved. So thank you very much. Something that I learned. Okay. So thanks to the organizer.
Thank you, brother. Thank you, brother William.
Do you have any suggestion that?
Yes, Panchami.
Oh.
Speak. Maybe മലയാളത്തിലായിരുന്നെങ്കിൽ പലരും ചോദ്യം ചോദിക്കുമായിരുന്നു എന്ന് തോന്നുന്നു. എലിസബത്ത് മാം ഇവിടെ ഉണ്ടോ? യെസ്, ഡോക്ടർ എലിസബത്ത് ഷൈനി. Again, network problem.
Good evening, Father.
Yeah, Pranita from Bihar.
Yes, Father. Thank you so much to Adi family. Thank you to speaker to given to such a knowledgeable webinar. Thank you, Aswati ma'am.
Yes, Pranita.
Yes, Father. Thank you. Thank you so much, Father, to you and all Adi family, and thank you to speaker to giving us such a knowledgeable webinar.
Yes.
So I am a great. Yes, Father. Thank you, Father.
Pranita Rani from Bethia, Bihar, was come to Attapadi thrice, and yes. Oh, it is so chill or what? We are covered here. So cold there. Okay, thank you, Pranita. Anyone else want to say anything? Vivilal? Vivin?
Yes, Father.
I can propose put off the YouTube live.
Okay, okay.